Welcome to Real Cases. This is a real life client story. What I'm doing here is sharing about who I'm calling Jeff. That's a fictional name because I've changed some things in this situation and story to protect anonymity. And also, even in this case, I've had multiple clients with similar situations to this. What I'm doing is choosing archetypes or situations that I see recur quite often that are actually based in real clients that I've worked with though. So in this case, Jeff is 42 years old, dealing with really bad pelvic pain and the perineum, more in the taint in the center, but also near the anus. Also urinary burning that is quite difficult to deal with. I mean, he's actually scared to pee because of how it feels, that this like warmth, this tingling, this screaming type of sensation. Another thing that was put into his intake form, he did have an affair, an extramarital affair, about a year ago, and his symptoms also started around that time, and they were very much STD-like, so he was very scared that he got an STD from this situation. But he's done all the testing and nothing is found, no bacterial infection, they're not finding any structural damage, and he's been very confused. So basically what I'm going to do is talk to you about, again, what he was dealing with when he came to me. I'm going to talk to you about what he's already tried, and then I'm going to actually turn and face as if I'm talking to Jeff. It's like we're having a one-on-one call, and I'm going to just talk to him and say what I would say to him. The thing is, I do this all the time in one-on-one calls or in the Overcome program, in the group experiences, retreats, and there are very specific situations that you're watching this video because maybe there's something in it for you. There's something that's related. And then I'll basically be telling him what I would recommend him do. In this case, maybe it's related to you, so you're listening. Love to hear your feedback on this video concept. It's completely new for me. So he's done all that. He's already tried antibiotics that were prescribed multiple rounds, really hoping it would clear something out. This like sort of phantom UTI or phantom STD-like symptoms are sticking around though. He's even tried painkillers because the pain gets really bad. It does fluctuate though. And more recently, he did PT for 3 months, thinking he's found, maybe physical therapy could help. And then he ended up finding some of my videos and reached out to me. So that's kind of where we're at. So I'm actually going to turn now and start talking to Jeff. So Jeff, I'm really glad you reached out, and I know it's been really difficult to be going through this for a year. I mean, I went through pelvic floor dysfunction and pain and things similar to this for 5 years. And I just want to let you know that things can change and do get better. And I've actually seen a lot of men have similar situations to this, the urinary burning, even though there is no obvious pathogen or structural reasoning. And I know the mind goes crazy. It's like, oh my God, there must be something wrong with my urethra, with my genitourinary system. There must be something that hasn't been found yet, something that hasn't been found yet. And of course, that is possible, right? We can never be 100% sure. However, it's important to realize that the brain creates sensations that we experience in our body. And knowing that your brain actually has your brain via also your nervous system and everything in your body, the genitourinary tract, can be activated. And this pain as well. So pain can serve as a messenger, and also dysfunction can serve as a messenger to notice, hey, there's something imbalanced here. It's ultimately helping to protect you as well from really uncomfortable feelings that are in the subconscious, that are inside of the body ultimately, and have not yet been released. So this is perceived as a threat by the brain, and the brain with an upregulated nervous system can then activate particular forms of pain or dysfunction. This is something that does happen even when there's not a structural cause. And it sounds like that's been going on. And you mentioned that, a really stressful, difficult, tumultuous experience was a year ago, and you were having this affair, this relationship situation that you got really scared because obviously it was a difficult time, and then telling your wife and the whole thing and the rockiness that you've had in that relationship as well, and the fear that you got an STD from this encounter totally makes sense. What happens is that you can get stuck in this fear-pain cycle, and the fear-pain cycle ultimately upregulates the nervous system more. There's even more high alert. The brain is watching out for threats even if those threats aren't real, they're not really right there right now, but even emotional distressors and, pressure and concern, what's going to happen? Are we going to get a divorce? Are we, like, a lot of things can cause this type of pressure and stress on our system that aren't acutely mechanical or from an actual accident or injury. So it sounds like that, could have started for you around that time. And then this type of pain and this type of sensation is called neuroplastic. Neuro meaning the brain is creating it, but for a reason, it's not faulty. And it can get stuck in that alarm position, that turned on position for a long time, and continue to reactivate the same neural circuits, though. They become learned. And plastic because it's changeable, though. That's the really good thing to know. This is not something that can't go away, at least to this point, right? Your medical team has not found anything structural. Even if there's something structural, of course, things can change too, but it's just good to know that. So to look at this, the thing is, it's good to know there's nothing actually wrong with your body. And it's like, why is this happening then? So there's no damage being done. It's very uncomfortable. The symptoms are very real. But why is it here? Why is it here? And what can you do to let it go so that you can just feel good in your body and go pee without being scared? And that's what I want to talk to you about. What's the path forward? What can we do here? I know you've been doing some physical therapy, and it's, you mentioned it has helped some, but really you still have flare-ups, hasn't gone away. It's giving you some relief. That's the thing, like, you can have some relief when you bring some attention, some love, some care to a part of your body. And if you have someone else who's there supporting you, watching out for you, giving you some hope, giving you some guidance, that takes away some of the fear in the mind, right? And a lot of the fear is just not knowing, like, what the hell is even going on? Why is this happening? And so, of course, I'm telling you now, but you can do more research behind neuroplastic symptoms and, psychophysiologic disorders if you'd like to, just to understand even the science behind it. But realizing there's nothing wrong with you, big weight off of your shoulders. Okay, so that's awesome. The next step is called reprocess. Reprocess is whenever you're experiencing that fear of, I'm about to go pee, or when you're peeing and it hurts. The mind does everything it can to squirm and try to push something around and block it and fix it, and like immediately wants to pull out your phone again, distract yourself with something, or start Googling again, or consider setting up another medical test. It's trying to fix, it's trying to figure it out, it gets frustrated. If you feel like you're effing yourself up, you're so scared that you're hurting yourself. So reprocess is experiencing your symptoms differently. It's like, okay, brain, I'm actually okay. Body, my body's okay. My brain is just sending me a message, and I am safe. I am safe. I'm going to be okay. I'm safe. It's going into a place of non-reaction. It's not fighting and knowing that things are going to fall away. And we have a tool called somatic tracking, which is in the Overcome program, and we use that along with other types of meditations that help you, especially early on in the earlier weeks, to be doing this reprocessing. Because you're like, oh my God, my pelvic floor really hurts though when I'm sitting down. And well, actually you mentioned too that it hurts because you work in home remodeling, and that work has been really hard on you because you have to move your body a lot. So even if it's just taking a 5-minute break, sitting outside next to a tree and doing somatic tracking or calming down. The thing is, there's kind of this background discontentment, this background discomfort and discordance that we keep running away from. But the thing is, it's not just the symptoms. That takes us to our next step, and that's release. The thing is, there's a reason why this is here. It's not a coincidence. It's not even a coincidence that it's in your pelvic floor or your penis. Whenever you look back, even in this case, it's a more direct symbology. Not everyone has such a symbolic and clear reason why it showed up in that part of the body, but if you think about feeling guilty, feeling ashamed or found out or whatever, of course, you've been talking to me about those emotions around this whole situation. But those are real, and those need to be experienced. Those need to be felt and brought up versus just kind of keeping calm and carrying on or burying it to move forward and trying to fix everything. This isn't mental. It's not something that you can just think your way through. Emotions are a natural part of life. They're meant to be felt. They're meant to be experienced. When they're fully experienced, they actually pass through you though. But if we're like on the inside, pushing them off, holding them back for a while, they can create physical dysfunction, pain, mental anguish, a lot of other things like that. So what I'll be guiding you to do, is how can you create some space and some silence? How can you express the emotions? How can you tell the truth to yourself and to others? How can you stop running away from it? Not that you were trying to, you didn't even know. Like a lot of people don't even realize the connection. But when these things can really be felt, when you can honor them, we can also forgive yourself, because if you haven't forgiven yourself yet, if you're feeling a lot of regret, and that seems like a tall order, right? There's a part of you that wants to punish yourself for these choices, for these life experiences. And there's always something that is learned. I mean, guilt is an emotion that's telling us, hey, we didn't hit a standard. We went outside of how we'd like to be. There's a message for us. There's something from that helps you, that matters, that helps you in your life. It's not all for nothing. It's about getting that message and then saying thank you, loving yourself, loving your past self, letting it go. But it's an emotional thing. It's not just something to say out loud or to tell me right now. People are different, right? Maybe they have a deep breathwork experience. They start crying and they come to their heart. Maybe they do some psychotherapy. They work with the therapist some, or there are different ways, different approaches that could help you there. Once that has been gone and it's really cleared out of you, typically there's a lot more of a lightness that's felt, a more aligned energy. You kind of feel that you're back in life. And then that last step, we call it reprogram or renew. This is really like, hey, who do I want to be now? Do I want to be more transparent, more honest, more clear, more communicative, more loving, more present with myself, with my wife, with life? Like, what is that? What do you want? How can you change some things? How can you notice the old patterns when you would fall into, I don't know, maybe lusting or watching porn or not saying something to your wife, even though it's something minuscule, but total clarity and honesty is going to create more closeness. Just as an example, so it's like finding things, letting go of that past self and renewing your life, renewing you. So it's not overwhelming. I know it's a couple of steps I mentioned, but it's really realizing there's nothing wrong with you and reprocessing when the symptoms are felt. It's just become learned pain, learned sensations. They'll go away. They'll definitely not be needed whenever you hear the message, and you can let that pass and you can live your life. So hopefully that was helpful, Jeff. All right, so that was the first real case. I would love to hear what you guys thought about it. I've never done this before. It may be crazy, but again, I have stories and situations that keep coming up. And I ask people sometimes, of course, like, can you do an interview with me? This story would change people's lives. And I have people like Jeff who get better and they don't have symptoms anymore. I'm like, people need to hear this. But the thing is, it can be hard to show yourself publicly, and I understand. Nonetheless, love to hear comments. Maybe you have your own case, your own situation you'd like me to speak to. I can't promise that I'll be able to do it for all of them, but do reach out if you need some help. And of course, we have some programs and support for you to actually make this change in your own life. That's what they're there for. I'll see you next time. Take care.